Zika virus. Top 10 alarming facts of Zika virus. Zika virus is a flavivirus that is related to dengue, West Nile yellow fever, and Japanese encephalitis viruses. The viruses are transmitted to humans by mosquito bites and produce a disease that lasts a few days to a week. Zika virus may play a role in developing congenital microcephaly in the fetus of infected pregnant women. Microcephaly is a birth defect where a baby's head is smaller than expected when compared to babies of the same sex and age. Babies with microcephaly often have similar brains and might not have developed properly. Zika virus was first isolated and identified in the Zika forest of African country Uganda in 1947. And has spread by outbreaks to many different countries, with an ongoing outbreak in Brazil and Puerto Rico. The first diagnosis of Zika virus in the US occurred in Harris County, Texas in January 2016. Virus is transmitted by infected mosquitoes that act as vectors to infect individual during a mosquito bite. In general, the virus is not contagious from person to person. The virus requires a mosquito vector to pass the virus to humans. Theoretically, donated blood and organ transplantation may allow rare person-to-person transmissions. Other possible ways may be mother to fetus and under certain conditions by sexual contact. The Zika virus incubation period is about 3 to 12 days after the bite of an infected mosquito. Symptoms may last about 4 to 7 days. Approximately 60 to 80% of infections do not produce any symptoms or signs. The symptoms of Zika are similar to those of dengue and chikungunya. the diseases spread through the same Aedes mosquitoes that transmit Zika. The Zika virus symptoms and signs are usually flat or raised skin rash, fever, joint pains, conjunctivitis, muscle aches, headache, less frequently, gastrointestinal discomfort with vomiting, and retroorbital pain. Rarely, complications such as dehydration or neurologic problems may develop. In Brazil, the viral infection has been linked to birth defects in newborn babies. Whose mothers became infected with Zika virus during their pregnancy. The prognosis for most Zika virus infections is good, however, complications such as microcephaly, if proven to be related to infection in pregnancy, would be a poor outcome for the newborn. Prevention of Zika virus infections is possible if mosquito bites from infected mosquitoes are prevented. The proximity of mosquito vector breeding sites to human habitation is a significant risk factor for Zika virus infection. Mosquito bite prevention. Cover up, wear long sleeves and pants. Stay indoors with air conditioning and screen doors and windows. Use EPA registered insect repellents. Wear clothing treated with permethrin. Remove standing water. Prevention and control relies on reducing the breeding of mosquitoes through source reduction and reducing contact between mosquitoes and people. Currently, there is no vaccine against Zika virus infection. Home remedies can help to reduce the symptoms of the disease and are as follows. Fluids to prevent dehydration. Acetaminophen can help to reduce fever and pain. Rest. Avoid aspirin and non-steroidal anti-inflammatory medications.